Well, thank you very much for joining us here today, and I hope we're going to have a vibrant discussion about the findings. And thank you to the Tiger Brands Foundation, represented here by Dr. Altman, and the NSNP, the National School Nutrition Program of the Department of Basic Education, represented by Carina Muller. They've been wonderful partners, and the support of the Tiger Brands Foundation made this study possible. So I just want to thank them and thank the rest of the team members who were involved. The team also included members of staff from the University of Fort Hare, led by Dr. Maya van Gent, and obviously they're not here for obvious reasons, but they were also wonderful partners on this project. So as a matter of background, despite South Africa having a middle income status, nationally about a quarter of households still experience hunger. And when we look at children, if we look at the fact that South Africa has approximately 18 million children, 22.8% of those still experience hunger, and a further 8% of those experience severe hunger. So we're looking at a third of children who are still experiencing hunger in this country. The worst cases of childhood hunger are in the Northwest, the Northern Cape, and the Eastern Cape, as we might expect, with the latter province, the Eastern Cape, documenting a food insecurity prevalence rate of nearly 40%. This number is an improvement since 2002, but it continues to be unacceptably high. To date, in response to this, the South African government has implemented 3 major policy initiatives to address the underlying causes of insufficient nutrient intake, and they include the provision of social grants, the Integrated Food Security and Nutrition Program, and probably, and the one that's of interest today, the National School Nutrition Program. Together, these programs represent massive investments on the part of state to alleviate the effects of childhood poverty. But what are the effects of those programs? So this is a graph. It's compiled of data from various different sources, and we've drawn it to be as comparable as possible, but of course, coming from different sources, it's not always as comparable as you'd like it to be. But what we see is if we look at how stunting, underweight, and overweight has been tracked over time, we can see that there has been a slight decline in stunting rates since 1994. Fairly persistent rates of children being underweight, and some decline in children being overweight over this period. So just to look at then the 2 programs that were of interest in the study. The first is the National School Nutrition Program, which is delivered daily to 8.8 million children in quintile 1 to 3 schools. As far as we're aware, and feedback from colleagues seems to confirm this, the program itself has never been assessed for impact. So there's been lots of monitoring studies done on the NSNP, evaluation of the rollout of the NSNP, but looking at impact hasn't been done. And that's because it's a very difficult program to evaluate for impact, given that all of the children who are eligible for the program are receiving the program. The objectives of the NSNP are to contribute to the enhanced learning capacity through school feeding programs, promote and support food production and improve food security in school communities, and to strengthen nutrition education in schools and communities. And I know that the director of the NSNP in Gauteng is here with us today, and thank you for coming along today. Then the second program was the Tiger Brands Foundation in-school breakfast program. And this is a program that was rolled out, was piloted a few years ago. We were involved in the evaluation of the pilot in Alexandra, and has since then rolled out to all 9 provinces. It reaches It reaches 45,000 learners, providing them with a daily breakfast during the school term. And the objectives of the Tiger Brands Foundation program are to improve the lives of vulnerable school children and their communities by implementing sustainable, scalable, and replicable programs, to complement the national education policy by partnering with DBE, and to support school leadership through the improvement of professionalism, teaching abilities, and management of school resources. These objectives are implemented through the provision of a nutritious breakfast and also through the installation or upgrading of kitchen facilities, nutrition education, skills, and community development, as well as job creation. And you'll see that when we talk about some of the qualitative findings, some of the perspectives on those objectives from the beneficiaries. So to come to the aims and objectives of this study, we wanted to assess the impact on learner anthropometric measurements. So that's on stunting, wasting, overweight, and obesity. Also to look at the impact of the programs on school attendance and on school performance. We also had secondary aims related to other benefits as well as challenges that stakeholders experienced, and to get a sense of the wider spin-offs of the interventions and the public-private partnership arrangement that is underway between the Tiger Brands Foundation and the NSNP. So the study was conducted in the Lady Freya district in the Eastern Cape. These are a few pictures, and I apologize that they're in pink. We did ask for them to sort this out. And I promise it's not because we're looking through rose-tinted glasses. So 52% of households in the Lady Freya district live in poverty. 36% of the households in the province experience hunger. So people in the Lady Freya district are mostly poor. Village and farm homes are very modest, ranging from small brick homes to mud huts to shacks and dilapidated structures. Educators and principals reported that children were looked after primarily by grandmothers and came from very deprived circumstances. It's a former homeland area, very rural, with all the commensurate challenges of access to services, high unemployment levels, and the like. Within this context, services such as grants and nutritional interventions become especially important. So the research was designed as a comparative study with a control group, and we were lucky enough to have 2 schools in a district close to Lady Freya, a similar district in the Kumbu district, that had recently been requintiled from quintile 4 to quintile 3. And that meant that they then became eligible to receive the National School Nutrition Program. But as we started the study, they hadn't yet received the National School Nutrition Program. So in a sense, we had a natural experiment occurring in the study, although the study was designed primarily as a comparative study. So we compared this control group of 276 learners in 2 schools with experimental group 1, which was the schools that were receiving only the lunch, the National School Nutrition Program. And there we had 570 learners in 31 schools. And another experimental group, which was the learners that were receiving both the lunch and the Tiger Brands Foundation in-school breakfast program. And there we had 541 learners in 8 schools. We took 2 measurements during the course of the study. The main reason we did that was because of this natural experiment occurring with the control schools. So we were able to go and see what was happening with the control schools before they started receiving the NSNP and later. And that the 2 waves of data also helped us on the reliability of the data from the other schools. It's important to note that the comparison is between the 3 types of schools and not between point 1 and point 2 in the timing of the study. So we weren't looking for changes over time. We were looking for differences between the different types of school. We collected data through anthropometric measurements. We collected data on weight, standing height, sitting height, calf skin fold, and tricep skin fold. School attendance records and school performance records that were provided through the schools with very strong support from the Eastern Cape Department of Basic Education. We collected nutritional information with a nutritional questionnaire with some of the learners. And then we did qualitative data collection with some observation, key informant interviews, interviews with school stakeholders, and focus groups with learners. Some of the limitations of the study. We always raise questions about the comparability of the control schools. Because they were quintile 4 schools that were re-quintile, they were not as poor as some of the other schools that were quintile 1 and 2 schools in the larger sample. They were also from a different district. There was no true control in the sense that there was none of the schools that were the same as the schools that were receiving the NSNP program that were not receiving the program at all. That limits our ability to account for school effects when we're attributing the results to the programs. So let's have a look at some of the data. This is a table looking at learners within normal height for age range, and we look at height for age as an indication for stunting in children. And there's debate as to whether children can catch up on height for age in the life course. Traditionally, stunting has been viewed as, once it's set in the first 3 years of life, children later on in life cannot catch up. Later research has suggested that there is some room for catch-up, particularly in the adolescent years. So there remains some debate as to the intractability of stunting over the life course of a child. What we can see here suggests that children who are exposed to an additional meal at school do have lower stunting rates than those receiving only the NSNP. So if you have a look here, the stunting, the percentage of children who are within the normal height for age range for children who are receiving only the lunch is 85.5%. When you look at the children who are receiving the additional breakfast, that goes up to 91%. And that is a statistically significant difference. Evidence from the study we conducted in Alex a couple of years ago shows that levels of severe stunting were reduced by 4.7% over a 10-month period once the breakfast program was introduced. So the data from both of these studies suggests that the introduction of an additional nutrition program may in fact be able to shift stunting levels. It's possible that the combined impact of the Tiger Brands Foundation and the NSNP has some impact on severe stunting levels. However, without conducting a study that accounts for stunting levels prior to and after the introduction of the breakfast program, we can't state with certainty that it's the breakfast program that is contributing to this change. But there are these debates, and this is a very promising finding that requires further investigation. And we were particularly excited about this finding. If we look at then BMI for age, and BMI for age gives us an indication both of wasting, so children being underweight, as well as children being overweight. We've got, as you can see here, very low levels of children in the far left-hand column, very low levels of children being underweight, which is a very positive finding, and no significant differences between the schools for the children who are underweight. For children aged 2 to 14, the overweight and obesity rate nationally is 28%, and the figures are much lower in the NSNP-only schools and the schools receiving both the NSNP and the breakfast program. And that's probably because we're looking at children who are at the school-aged children. So the Sanhains report reports on children 2 to 14. So you can see here the children that are within the normal BMI for age range, almost 65% in the control schools, much higher levels in the schools that are receiving the breakfast program, and even higher in the schools that are receiving the additional breakfast, the 78.8 for lunch only, and even higher for children who are receiving the additional breakfast program. And so there's a stark difference between the schools receiving the meals and those at the control schools, where there is a serious problem with overweight and obesity. If we look at the overweight and obesity results, what we see here is in the control schools, 26% of the learners were overweight and almost 9% were obese. Combined, that gives you a total of nearly 35% of learners being overweight or obese in the control schools. Much lower rates of overweight and obesity in the schools where the children are receiving lunch or where they're receiving lunch and breakfast. If we look at just the intervention schools, so in the schools that are receiving just the lunch or the lunch and the breakfast, children at both intervention schools were significantly less likely to be overweight or obese than those in the control schools. And children at schools receiving breakfast were significantly less likely to be overweight or obese when compared to children receiving only the NSNP. So you can see here, 17% of children in the NSNP only schools were overweight or obese, compared to 11.5% of children in the schools receiving the additional breakfast. These findings were particularly important for girls. So girls are traditionally more vulnerable to overweight and obesity, but what we found was that in the schools that were receiving the additional breakfast, the girls were no more likely than the boys to be overweight or obesity. So it suggests that the additional breakfast has a particularly protective effect for young girls. This is a really important point to be publicizing. Childhood obesity is strongly associated with adult obesity and with non-communicable diseases such as diabetes and heart disease. The protective effects of the NSNP and the breakfast program may therefore translate into longer-term economic benefits in terms of a healthier population. And we have seen quite a lot of media attention on the issue of overweight and obesity recently as a health issue. And this seems to suggest that early interventions might play some role, not the only role, but some role in protecting. The one time that we did look at the change in data over time was within the control schools. Because they started receiving the NSNP just after we collected the data, the first round of data, we were able to see whether there were any changes in their outcomes over a 5-month period. Now, 5-month period is very limited, a very short period of time for us to be seeing significant nutritional changes. Ideally, a longer-term study would have been beneficial, but there were various constraints that meant we couldn't do that. But we did look at what the changes were, and interestingly enough, we did see a reduction in the rate of overweight and obesity, or particularly children being overweight in the control schools. So you can see there down from 26.1% to 19%. However, given the comparative data between the different school types and this reduction, it seems that we can see some protective effects of the program on overweight and obesity. If we turn our attention now to learner performance, we looked at the change in a learner's performance from term 1 to term 4 in the year of study. We also looked at the control schools in the year before they started receiving the NSNP to get some comparative indication of what sort of rates we could expect, rates of change we could expect. So what we can see here is that their performance improves over the course of the year, and that we would expect. We would expect children to be getting cleverer as they progress through the school year. But what is very interesting for us is that children at the intervention schools are doing better than children at the control schools, at both the intervention schools. So the blue line is the control schools in 2013, and the one above that is the control schools in 2014. Then you can see the gap. The green line is the NSNP only schools, and the line above that, the yellow line, is the schools that were receiving the Tiger Brands Foundation in-school breakfast program. What's quite interesting about this is that the Tiger Brands Foundation does typically target the most vulnerable schools, and to see that these children are performing better is very promising indeed. So children at the intervention schools are doing better. We can't necessarily attribute that directly to the programs. We know that learning is influenced by a range of other factors that we didn't track in this study, that factors that are much more likely to influence educational outcomes. Nevertheless, it is promising to see this difference between the schools. Learner performance is certainly perceived to be improving. And when we spoke to the children, they were saying, we don't get hungry like before, we don't sleep in class when we've eaten, we like breakfast, it makes me excited. And what we see, what the teachers and the principals report is that children are coming to school on time because they're coming for breakfast. They start with a full stomach, and often they start the day with your maths, your numeracy type curriculum. And so they are starting with a brain that is engaged. One of the teachers said they are concentrating the whole blessed day. They are bright now. School attendance. All schools reported minimal problems with absenteeism. But what we did see was an increase in zero absenteeism in the intervention schools over the course of the year. And that means an increase in the number of children who were not absent at all over the course of the year. Schools receiving the breakfast had the highest zero absenteeism rate. And there's a strong perception that breakfast is an incentive for children to come to school. And it encourages learners to get to school on time. Some of the other benefits, I mentioned that one of the interventions from the Tiger Brands Foundation is to either build or renovate school kitchens, and you can see here one of the container kitchens and one of the food handlers working in one of the kitchens, and the school stakeholders viewed these interventions very, very positively. And not just for the delivery of the Tiger Brands Foundation breakfast program, it is also used for the delivery of the NSNP lunch, and it is often used when there are events for the school, so it helps the school with some income generation as well. They also, a lot of the stakeholders mentioned public-private partnerships and other partners coming on board that were supporting, for instance, school veggie gardens. One of the reported results was around the practice of coming to school and eating together and the routine of breakfast. So what can we conclude? Nutritional interventions at the schools studied have an important effect on reducing levels of children being underweight or wasted. And the breakfast program has a particularly protective effect. Very interesting results pertaining to stunting. Although stunting is thought to be resistant to change, this is open to debate. And the data presented here may mean that the additional nutrition of the breakfast was shifting stunting levels. The same effect was seen, as I mentioned, in our ALEX study, and this requires further research, but does indicate some promising findings. The higher rates of stunting at the NSNP-only schools are a cause of concern and points to the need for earlier investments in childhood nutrition to prevent stunting. The best time to intervene is in the first 3 years of life, and this may mean coordinated efforts between DBE, the Department of Health, and the Department of Social Development to ensure that children in the first 3 years of life and those that attend early childhood development centres are targeted to eliminate stunting. There are very clear protective effects of school nutrition for preventing overweight and obesity. And it's also clear that the addition of a breakfast further reduces the risk of obesity for children, and particularly for girls. The latter finding is supported by the data from the study conducted in ALEX, which also showed that levels of obesity were reduced over a 10-month period after the introduction of a breakfast program. These findings are positive both in terms of the short-term outcomes for children as well as the long-term health benefits, because both stunting and obesity are related to adult obesity as well as non-communicable diseases. Protecting children from early obesity or stunting presents a possibility for a good return on investment. Learners at schools receiving nutrition interventions perform better than those who do not receive such interventions, and teachers report better concentration and participation in class, the building blocks for learning success. Taken together, these findings present a strong case for the continuation of the NSNP and the value of adding a breakfast program to schools. However, adding a breakfast program should, as a straight option, should be treated with caution. Further research is required to understand what is it that's delivering the impact. Is it the timing that they're getting 2 meals a day? Is it the kind of nutrient intake? Is it the combination of breakfast and lunch? And how will adding an additional meal impact on the ability of schools to deliver meals effectively? We certainly don't want to compromise the ability of schools to deliver one good meal if they're having to spread resources to deliver two. All in all, the study provides positive evidence about the impact of the NSNP and the additional impact of the Tiger Brands Foundation in-school breakfast program. The predictive effects for stunting, overweight, and obesity in combination with the better learner performance amongst learners receiving the breakfast, the additional meal results in very positive outcomes for children. And the public-private partnership model is one that seems to be yielding positive results and is a model that can be learned from as new partners are brought on board to expand the breakfast reach. These findings pertain to one district, of course. We were able to confirm some of the findings that arose from the study conducted earlier in Alexandra. But ultimately, if we want to answer some of the questions raised here about stunting and confirm the findings about the effects on overweight and obesity, there is a need for a larger longitudinal study to see whether these findings hold. And that's me.
Thank you.
The University of Johannesburg. Rethink, reinvent.